Extrovert I here, an in-depth study of audio processing disorders. So what is audio processing disorder? In its very broadest sense, APD refers to how the central nervous system uses auditory information. However, the central nervous system is vast and is also responsible for functions such as memory, attention, and language, among others. To avoid confusing APD with other disorders that can affect a person's ability to attend, understand, and remember, it is important to emphasize that it is an auditory deficiency and not the result of a higher order cognitive language or related disorder. In other words, it is a processing deficiency in the auditory processing center that can affect the way the student learns, remembers, and understands material. Students with APD can't process the information they hear correctly because their ears and their brain don't fully cooperate together. So this is going to show you what normal hearing looks like. So a sound is going to be recognized by the outside of the ear called the pinna, and then it's going to be funneled into it by the outer ear. It's going to travel through the ear canal to the eardrum. The eardrum is going to recognize the vibrations and send it to the inner ear, known as the cochlea, and the tiny hair cells in there are going to send that message through the auditory nerve to the processing center of our brain. But somebody with APD, when that sound is sent down the nerve, it's going to get damaged, since the nerve itself is damaged. So people with APD, the message or the sounds that are sent aren't received correctly by the auditory cortex, and this makes it difficult for the auditory cortex to properly distinguish sounds and is often confused by the sounds that it receives. So these are some warning signs. APD on the surface can look like a hearing loss. So if you have a student that has to sit in the front of the room, commonly requires repetition, avoids or has trouble in noisy environments, has trouble remembering verbal instructions, or has a delay in their speech development, they may not suffer from APD, but they definitely should be tested. And then APD affects our 5 auditory learning systems. So the first one is auditory figure ground problems. So this is like when a child can't pay attention if there's noise in the background going on in the classroom. There's auditory memory problems. This is like remembering something that was told to the student. Auditory discrimination problems. This is having trouble hearing the difference between certain words. This can affect like directions, reading, spelling. There's auditory attention problems. This is when a child can't stay focused on listening long enough because it's a task. It's not something that they can just do easily. And auditory cohesion problems. This is like when higher level listening tasks are difficult. It's like drawing inferences from conversations, picking up on jokes, understanding riddles, sarcasm, picking up on things like that. So do's and don'ts for the classroom. Some do's are definitely reduce background noise when possible. Sit these kids in the front of the classroom or near wherever you're going to be speaking the most. Encourage the use of assistive devices such as FM systems, and have them take their tests or assignments in an area away from distractions. Some don'ts, definitely don't get annoyed if the student requires repetition. Don't give the information only via lecture. Make sure to incorporate different learning styles, and don't call them out in class if they appear to be not listening. Just maybe like walk around and encourage them to get back into it. And these are 3 helpful sites to understand more. And that's it.